Rainbow program is actually part of the Association of Family Physicians of India, and the name was given to me to take it further. The rainbow represents the different colors, as actually is meant to be from different parts of the world outside India, with a view to exploring how the physicians, family physicians outside India can help to develop the faculty of family physician in India. So it has got the faculty, AFPI has got a rainbow program, and I chair that session with Sonia Mehra and Dr. Santosh have joined this year with me. I'll quickly summarize our vision and bring it finally to what our thinkings in this line, and I'm quite happy to take some suggestions how to take this forward. We have an interesting discussion here about the generalism and the specialism, but Moed Gray, who was a professor of screening in UK, said that generalists deal with complex cases, specialists deal with complicated cases, and we need both for good clinical care. I'm not going to tell you all, because I don't even work here, that what the healthcare system of India is, but this is an outline that we have around 26,000 government-run primary care centers, 615 district-level hospitals, which are backbone of the public health system. Unfortunately, these are being underutilized for whatever reason. And there are around 200,000 privately owned general physician clinics, and mostly they possess the qualification of MBBS. Around 80% of the population in India turn to private caregivers, and more than 75% of their health care spending is out of their own pockets. I think we have had enough about the universal health coverage in this conference. And I think even our health minister was very aware that India has got a double tragedy of both communicable and non-communicable disease burden that we need to address too. This is Michael Kidd. He was here, one of the speakers. Wonka president is also a practicing GP in Australia, which he said, we have to focus on disease prevention, health promotion, better chronic disease management, earlier detection of serious disease, and treatment. And all this we do through having a strong primary care basis. Actually, this is the bread and butter of work that GPs around the world do. Therefore, any capacity to build and deliver universal health coverage has to fall on the generalists. Des Spence writes regularly in the BMJ. He's a GP in Glasgow, and he said, generalists are most important economic, medical, and social professional group in the healthcare. The good generalist, however fat, is worth his or her own weight in health cost saving. However, if he does Milka Singh, he will not have photograph with that fat GP anyway. So who needs specialists then for uncomplicated cases? And that's where the post-graduation training for the family medicine comes into picture. And like we have all said, Raman Kumar also says that for creating family physicians, like Santosh said, we need to teach family physicians contextually where they are going to deliver the care and not in the tertiary care hospitals. And evidence shows that India must prioritize general practice to achieve the universal health coverage where the specialist status needs to boost, says Claire Gerrara, our previous chair of the RCGP of UK. This is actually economist is saying that if you do not take care of your health system, there is no way you are going to achieve your superpower status. I think this was a letter, holding dusts in many of the departments. If this actually worked, this was done 2 years ago from our then Health Secretary as a result of his attending the last conference here. What he says, if you train a trained family physician, a single postgraduate family medicine can do the works of a surgeon, obstetrician and physician, pediatrician, as well as the public health work at the CSC level. So what can Rainbow do? Actually, it's easier said than done, that we have to think globally and act locally. The physicians outside India are not a coherent group that one can actually link to. So therefore, they have to be organized first in a regional basis, forming the Rainbow chapter of, say, USA, Canada, Australia, etc., and Singapore first. And then we have now the leaders of AFPI in different regions. For example, in Kerala, Vijay is busy doing something there. So we need to actually then join hands to develop things locally. Say, for example, if he is running local program, then the faculty from outside can join there and give hand and work in partnership. And more than that, we can join hands together to lobby the health minister to start the faculty in the respective states. And sometimes probably we have to play the tactics game. If say Kerala can do, then Odisha and West Bengal probably can do. So use any means to convince our political leaders to start MD in family medicine so that we get the faculty to train it further. It's a kind of question of chicken and egg, but I would prefer to start with chickens. If we get the leaders first, then it will lead further. And yes, that should be our approach. But basically, to summarize, we need to work together. And going back to this heterogeneous group of GPs outside India, we have to also turn to the local bodies in the country. So, for example, in the UK, we have just started talking to the Overseas Doctors Association, and they have promised that they will give access to their access of GPs in their network. So therefore, as someone said, this is not corporate world anymore, is the modern cooperative world that we have to put all our strength together to achieve this, creating faculty of family physicians in India with a view to providing a family physician to each family in India to achieve that goal.